So here's what I know so far.
Okay.
Obviously, the right eye is better than the left eye.
Mm-hmm.
The vision on the right eye on this eye chart right here is about 20/50. You're getting 1 or 2 letters on the 20/40 line.
That's what they called me last week when I went to the ophthalmologist.
So you're somewhere in the 20/50 to 20/40 area.
Mm-hmm.
And with macular, it will vary.
It does, day to day and
Yes,
week
it
to
will.
week.
So if we say your vision is 20/40, for example, tell me what that means.
One of them probably means near and one far. No?
Good idea, but no, not it.
I don't know. I know all my life I've heard 20/20.
It means at a distance of 20 feet,
Yeah.
you're seeing the letter that we call the 40 line.
Oh, okay.
That's the size.
Oh, okay. And the 20 line's what I should be seeing.
And the 20 line is half the size of the 40 line. So you're seeing letters on the eye chart that are twice the size of what you normally see. Actually, slightly larger than that, maybe 2.5 times the size. Okay?
Mm-hmm.
So what does that mean in real life? It means when you're driving, you've got to get twice as close to signs, traffic lights, people, to see them the way you used to. That's what it means.
I said that to them on the way here. I read Center Street, and I said, I have to be a lot closer to read that.
Exactly. So that's what it means in the world.
Mm-hmm.
What does it mean in the field of eye care? It's very interesting what it means in the field of eye care, because according to the World Health Organization, 20/40 is a very minimal vision loss. So to eye doctors, 20/40 is not a big loss.
Mm-hmm.
To patients, however, it's not a very minimal vision loss, is it?
No, it's
No.
not.
In fact, 20/40, 20/50 vision is incredibly frustrating. I've seen an awful lot of patients with that level of vision, and they're virtually all the same. They are very, very big complainers. They are just frustrated as can be, annoyed, complain that I can't do this, I can't do that, and then when you watch them, they obviously can. Because what they mean is, I can't do it like I used to, but they leave the like I used to out. So you hear I can't do it. I give her a newspaper, I know she can read it.
Nah, I don't know about a newspaper. Something a little bit bigger.
Yeah, if I put some good light on it, you'll read it, but you'll read it slowly and difficultly, and you'll complain I can't do it. So, plus you've got the difference of the two eyes, which affects the depth perception, so it leaves people very, very annoyed. Interestingly enough, the people who have lousy vision in both eyes are much more relaxed. They don't complain nearly as much.
So I have something teasing them, or like
I don't know the answer. I don't know why, but I know that that's the case.
Well, that's like I said, it feels like what I imagine a cross-eyed person look like. I'm seeing some of there, and then I'm seeing
Very
some
annoying.
There, and I don't know how to combine the two.
Well, here's the bright side. If the vision gets worse, you're going to feel better.
No.
No, we don't want
I
that,
said
do
I'd
we?
rather lose a hand or a foot or both
I
of
know,
them than
I
my
understand.
eyes.
All right, so the good news and the bad news. The good news is, yes, I can help.
Okay. I
That's
have
the good
questions.
news.
Okay, I have questions.
Okay.
We talked just briefly, and I've seen ads about these telescope things.
Yes.
And we talked about the price, and one for driving and one for reading. And I'm wondering how often you probably have to have those redone.
Very rarely.
Oh, really?
It's amazing. Which is why I tell people any changes over the next year won't cost you anything.
Okay.
This doesn't happen often.
And was there a time going to come when I can't use, then those would do me no good?
Well, you'd have to get a new condition, because with macular, only the central goes. So you're always going to
Right.
have peripheral, and it always magnifies.
I
So-
told people I can't see his face, but I can see the ceiling fan going and things
Yeah,
like
so
that.
the odds of, with macular, there's no chance of you losing everything.
Oh, thank God.
You'd have to come up with something
Thank
else.
God you made me happier right there.
Well, I know doctors have told you that. They
They've
have to
told me
have
that
Yeah,
I'll
you just-
never go
you just-
completely blind.
Well, you just don't want to believe that.
Yeah.
Okay.
If I can't paint and I can't drive, I've gone blind.
Well, let's work on
Although
those.
I think maybe I could change to abstract.
that's positive. outside.
All right, so the good news, I can help.
Oh, thank you.
The bad news, you won't necessarily like it.
Oh, you mean the things I'm going to wear?
Well, nothing will give you back what you lost. Nothing is going to be like it used to be. So 20, 40, 20, 50 patients never seem to be thrilled unless they can have back their 2020. It's just the nature of the beast. So we'll start with reading.
Okay.
Okay? We want to get your reading better?
Yeah.
All right. So we'll start with that.